Hi, hello, and welcome to this webinar on Medical Copilot. I will be joined here by Daryl Salas. He's the lead of Americas at Hopsworks, and Fabio Buzo, who is our VP Engineering and co-founder. So we'll jump right ahead. It will be rather short, and I will leave it to Daryl.
Thanks, Lex, and thanks everybody for joining. We're going to show you a demo of our Medical Copilot. First, I'll give you an overview of what the Medical Copilot is and what problems it solves and what results to expect. So Medical Copilot is just as it sounds. It's a copilot to help healthcare providers provide better care, and it helps them be more productive or more efficient. It's assisted by artificial intelligence, and the result is that you get significantly better insights if you're a provider or a researcher, improved screening and treatment plans, and like I said, better productivity. So the treatment life cycle in this copilot involves assessment, imaging and detection, diagnosis and prognosis, and then the actual treatment plans throughout. And the Medical Copilot has context panels on the Copilot for each of these stages in the treatment life cycle. And the Copilot provides personalized insights specific to the patient or patients that are being examined. And what's unique about the Medical Copilot is it combines traditional business intelligence with artificial intelligence. And the reason we do that is because a lot of information, an individual patient can have a lot of information associated with them. So if you're 100 years old, you could have multiple office visits over those 100 years. And throughout those visits, the information goes into different places, right? So to be able to access all the information when a patient comes in is impossible today, especially with the burden that healthcare professionals have. But with Medical Copilot, you're able to access all of that information in less than a second. And also, there are a lot of best practices that are published by standard boards, such as risk factor calculators. All of those best practices can be taken into account by the Medical Copilot. So the big data problem where people get overloaded with information and can't take into account all the information, that's not a problem when you bring AI into the solution. And so that's why combining the traditional business intelligence with artificial intelligence will get you these tremendous results that we're expecting. And so this is some more information on the context panels throughout the treatment life cycle. What we did was we created some of the most common questions that you might have as a provider or researcher. And we put them in the context panel so you can select these questions if you have a question, or you can create your own in natural language. And a lot of these questions are really trying to find the information that could have slipped through the cracks, or find out what additional questions should I be asking based on this particular patient, because intake forms, for example, are standardized, and so they might not take into account other questions that would be relevant for a specific patient. So you can ask the Medical Copilot, what other questions should I be asking, or what other tests should I be taking to get a better diagnosis? So these are the questions in the context panel, and we're going to be showing you a live demo of these questions. And we go through prognosis, treatment plan. And then we have behavioral insights where you can look at the patient journey to see, let's say you have a particular condition and you want to see what office visits or encounters that the patient had throughout the visit. You can get that information through the behavioral insights context panel. And so I mentioned this is cutting edge technology that combines traditional business intelligence with artificial intelligence. So what do I mean by that? We're using a technique called function calling, which is really traditional business intelligence, and we're combining it with large language models and generative AI, along with vector indexes. This is a technique that has been, in my opinion, overlooked. A lot of focus nowadays has been solely on large language models and vector indexes, but those only get you insights, basically inference insights into unstructured questions, whereas a lot of the reliable information that you're going to need and the information that you're going to need to personalize your answers is coming from structured questions, and your current IT systems have those kind of the data that is structured for those to answer those questions. So we're using function calling heavily in the solution, and then the large language model. We use a machine learning model to classify images. There's some research that suggests that this large language model, this MonAI model can do a better job than generalists at observing conditions in medical images, although not as good as specialists. However, the reality is that the front line or the first line of care in healthcare is coming from generalists. So the Copilot can help those generalists with more insights. I mentioned we have a vector index. Here's what the vector index is used for. You can bring in department, company-specific information, standards, policies, so you can tailor your answers to the department or whatever context-specific tailoring that you want to do. The generalized large language model has a lot of the best practice publications, such as the risk factor calculator is in the general large language model. Some standardized treatment plans are in there. And then Hopsworks Conductor is what puts it all together. So when you ask a question, parts of the question are going to go to get the structured data is going to be needed for it. Parts of the question you might need vector index for, and other parts you might need the generalized LLM. So the conductor orchestrates all of the retrieval and combination to get the answers back. So for the assessment, detection, diagnosis, here are some of the questions that we have in the context panel that I mentioned. The kind of predetermined questions that are suggestive that you don't have to use these questions, but gives you an idea of some questions that you can ask. And then on the right-hand side is how we answered those questions. So let's go right into the demo now, and I'm going to hand it over to Fabio.
Oh, okay. So we have the application here. This is the user interface. So the first step we said is to look at the detection. We have all the different panels that we have that we were talking about earlier on the left side. And so the first one is to do detection. So we put in the patient social security number, which we always have like a random number here. But anyway, so the other thing we do is, since the MonAI dataset we are using as a starting point, the MonAI dataset is basically looking at X-rays on in particular the chest area, right? And we basically it takes input two things, right? It takes input the image itself. It takes input the report from the technician, right? So the technician just looks at the report, and it kind of gives a kind of a that kind of impressions and its findings, right? So we're going to use the model to essentially do the following: just essentially get kind of a double checking this combination of the picture and the technician report to get both a summary essentially of what the findings are and what the impressions are from the technician, as well as the model output, right? So the model outputs model is trained to classify around like 10-12 disease conditions, and the model is basically going to give you back a probability of that the image and the report is actually that condition. And so we're basically asking the model to say, okay, what's most likely, given the impressions, given the findings, given the model for the model predictions, what's the most likely things that can happen, right? It basically predicts that there is some residual recurrent pneumonia on the right lower lobe, like somewhere, I guess, like here. And then once we get that, right, this is the interaction with the model. We send a request to the model, retrieve that information. We can go and ask additional questions, right? So we want to know what's everything you know about. If you are a doctor, like what information you have about a specific patient, right? So what basically happens in the background is that we have a data set of all the patient data, their inputs, like the different encounters they've done in the past, the different visits and different tests they've done. So what we're basically asking the LLM is to go and look at the entire history of the patient and basically summarize it for us, right? And it takes a bit of time specifically for this patient because this patient is 93 years old. So, I mean, there's a lot of history here. You see here, the patient ID is patient 1, essentially. And we basically have the entire history. So this is actually, we have all the patient histories. I mean, I think we have like something like 10,000 patients, something like that. And we have that in a format which is called FHIR, FHIR, which is actually like a format that we have encountered multiple times when we work with health insurance. Is pretty good standard to kind of encode information about patient and the interaction that the patient has with, let's say, the medical environment at large, right? Whether it's doctor, tests, insurance companies, hospitals. So you can basically track your information and can track your kind of your life across kind of the different environments, right? So there is quite a lot of data for this specific patient, right? But we don't care about the number of times they open a specific claim, or if they actually tells you which insurance they have at the moment, but doesn't necessarily matter too much. All this interaction with like the admin stuff of the side of the healthcare. And so what we're actually doing, instead of just throwing the FHIR data set to the LLM, we're actually in the background processing this FHIR data set so that they are ready for the LLM to use function calling to be able to retrieve the necessary information about the medical history, the recent observations. I think that the cutoff time of the set that we have, the different if they have medical notes. What are the most recent medical notes? What are the assessment of the doctors that visualize them? And obviously, we have also the findings from our just the one that we just made a prediction on, right?
Nope.
We have what has changed since the last visit. We know what's the last visit from each patient is. So what are the last observation from the last patient? And then we can ask like, what are the trends that we've seen across this patient, right? Again, what we are providing to the LLM is basically just the data behind this store and Hopsworks. We're basically querying the Hopsworks the data sources to be able to retrieve the information for this patient, and there is like, this is information, please give us back all this let's say top level items, right? What are the risk factors and things like this, right? You can go and you actually you can highlight specific actually this is actually for this patient, you can highlight specific items that you wanna look at. And for instance, we're gonna highlight what are the specific risk factors. Good, change response. Yep. Obviously age, smoker, cardiac condition, alcohol use, and things like this, right? So kind of highlight this kind of information. But you can also do, and like based on everything everything we have encountered so far, you can actually be proactive and say, okay, what question should I ask the patient in order to like kind of make the make my diagnosis correct, and also make my treatment plan really adapt to this specific patient, this specific specific condition, right? Again, so it's tailored to the original problem that we are looking at. So the patient shows up with some residual pneumonia, so we're going to be looking at things like respiratory symptoms, whether or not they've been taking the medications, whether or not they've been smoking or they're quitting or things like that, right? So you kind of have questions that are basically a combination of the data that the patient has and the specific problem that we are facing right now, right? And things like this, right? Once we have this, right, we can kind of move on to the next stage, I would say, and ask for instance, okay, can we make a diagnosis? Do I have enough information to actually diagnose this specific condition? Or what other information do I need, essentially, right? Usually for this one, it's like for this specific case, I was playing on it earlier. The case is pretty solid so far. So there is additional data, particularly, there is also, he actually finds additional items like, hypertension, obesity, and prediabetes, which is actually looking at the general historical information, essentially, right? And it tells you also what, and if you want to look at like, prediabetes, there's a slight increase in hemoglobin, blah, blah. And then also obesity and so on. The nice thing about it is the how do you say, the LLM that we're using behind the scenes has not been trained on specifically medical data, right? These are general purpose LLM and that we're using. So all this information can be even improved, right? If you bring in specific additional information like textbooks and obviously research paper on specific diseases and things like this, as well as if you have a fine-tuned like a large language model specifically for this problem, right? And finally, you can look at things like, okay, what's the treatment plan, essentially, right? What's the treatment plan for the specific case, right? And then it's going to generate one. I get this like general purpose one. I was always looking at the residual pneumonia, looking at antibiotic therapy, and then supportive care, looking at scheduling a follow-up on the chest X-ray, and then potentially vaccination and things like this. So this is kind of the getting us to kind of like a proactive decision on what to do next, essentially from a doctor perspective, right? And what to suggest next on the perspective. yeah, so this is kind of the like looking through, like going through a case, right, to bring it together. Yeah, some models. In this case, we bring together the chest X-ray model, but like the CT scans, looking at all the type of imaging that can be brought in, right? So the starting point can obviously change, and then you start building out the case by looking at the different history of the patient, looking at the case, look at all their events that they have kind of added in their medical history, right? Look at some behavioral insight, right? So if you look at, for instance, can you show me like the journey of this patient across like it because it was pneumonia? This is actually look at like kind of the entire history from like the from the what else is it now? Blah, 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 blah. Yeah, so actually it looks at what is it starting? Oh, that's somewhere in the middle here. But it looks at different at the history of the patient, and looks at like how from there you go, from this one, how this has evolved to like the like next encounter, and so on, so you can actually get and dig through some of the previous treatment plans, and now they have stick to that treatment plan, and how you kind of without this kind of follow-up images and things like this that happen essentially.
All right, thanks. I think we can take a few questions perhaps, and for all the questions we cannot take, we'll send you an email. I should mention just before that the recording of the video will also be available perhaps tomorrow or about. We'll also likely share the slides. And yeah, I'm leaving it to Daryl and to answer questions. Thanks.